Welcome to the office. Nice to meet you.
Nice to meet you.
Welcome to the office. How can I help you? Why are you here?
I have very bad back pain.
Okay.
And it's bothering me, and at night my legs are in pain. So
What does it mean you have back pain?
back pain,
Stiffness, sharp, achy.
not sharp, something dumb. Like I'm not feeling it, but something is bothering me.
Started when?
I will say maybe 4 or 5 weeks ago.
Before 4 or 5 weeks, you had no back issues?
No, I think I don't have it.
Okay.
So
what happened 4 or 5 weeks ago?
So I went to massage, and after that, I feel something is bothering me.
Okay.
So I'll try not to pay attention, but after that, maybe 2 weeks after that, I start having some leg pains. I don't know, it's coming from my back.
Okay.
Or it's
Leg pains meaning on both legs or?
both legs.
Both
like
legs.
When you're feeling tired and
Heavy?
heavy and pulling down.
And less power?
Yes.
Okay.
Yes.
More on the right, more on the left?
Both, I will say.
More?
Both.
Both. Okay.
Yeah.
I got it. What else?
This is the main thing.
Okay.
And a little pain and something is here. Maybe.
In the neck. Okay.
Yeah.
All right. How'd you find me?
I just like watching Instagram, telling
Okay.
the truth. Like I was going around the videos, and at the same time I have that pain, and I was thinking where I have to go, and like I don't know, for a sudden I got your videos, and I start researching your Instagram page. I'm
Okay.
like, oh, I got him.
All right. And you're not far. You're local.
Yeah.
That's also really cool.
Yeah.
You're just over the hill.
20 minutes.
That's pretty cool. Okay. So nothing else going on?
No.
You've had x-rays taken before? You've had any injuries you recall or remember?
I didn't. No.
Sure?
Yeah.
Okay. Well, there's a few things I do need to talk about on the x-ray.
Okay.
And my suspicion is this, okay? You've had stuff that has been developing over the years, whether you're telling me or not, I can see it. I will show you. Whatever happened 4 or 5 weeks ago was a trigger. There's a process that's been going on in your body. And it's a common thing, you know, people will tell me, this is good information for everybody, is, you know, I just woke up and my back started hurting. I just went to pick up a pen, doc, and my back went out. Well, that didn't throw your back out. That was a trigger or an event of a process that's been going on all these years. I'll show you. Okay? And once I show you and examine you, I think it's going to make a lot of sense. Have you seen anybody for any of this?
No.
So why now?
I don't know, because I don't have like that feeling that I need to see doctor.
Okay, fair enough. You're in for a treat, okay? You ready? Come, let's get started. Let's go over your x-rays. All right, there's a lot of information here, Kristina. You have questions along the way, you please ask me. I will make sure you understand everything. You came for one thing, I'm going over everything.
Sounds good.
Okay?
Amazing.
That's why you're here, I hope. Let's see. So on this x-ray, we're looking at a few things. We're looking at the posture, we're looking at the curves, and we're looking at the disc spaces, okay? We should have a 40 to 60 degree curve in the neck, 60 degrees in the mid-back, 60 degrees in the low back. First thing we can see is we're developing a slight reversal of the curve here, okay? Now, I'm going to show you something interesting. Let's look at your posture. We're going to run the posture line from the lowest lumbar. We're going to run it straight up. And what I'm looking at is this. This line, the ear, shoulder, and hip should all line up together. And what we're seeing is the upper part of your building behind your foundation. So I know these muscles get tight. You get tight and stiff when you sit for a period of time. And that's related to your posture, okay? So we're going to talk about how to fix the posture, and I'm going to have you do your homework. They are easy, consistent habit changes, okay? It's key. You can go, I can give you all the great adjustments, you know, you can go somewhere and get all the great adjustments, but there are a few things you have to change, okay? Now, so posture, that explains the tightness in the muscle. Curvature, we said we want a little more curve in the neck and the mid-back. Now, here's the thing I need you to see. Let's go to the low back. And what I want you to see are two things. First thing is we're looking at the tailbone, okay? And when we look at the tailbone, this should be a smooth arc. And the way I see it, there's a couple of things going on. Number one, you have 1, 2 potential old tailbone injuries that you had way back when. And that started the process of how your tailbone and how your foundation formed. Now, let me show you this side, and this is a big answer here. So when we're looking in the lumbar spine, okay, this is important. Typically, we have 7 bones in the neck, cervicals, 12 in the mid-back, thoracics, T1 through T12, 5 lumbars. 1, 2, 3, 4, 5. You have 6 lumbars.
Okay.
Now let me explain it. You don't have really 6, you have 6 functional lumbars, and this is what happened. This isn't 10% of the population, and the reason I'm explaining it, there's no surgery or anything for this. There are habits you will need to do based on your situation. In 10% of the population, I have patients that have 4 lumbars or 6. Now, how does that happen? In the person who has 6, the tailbone is 5 pieces, 5 sacral tubercles that form one bone between 32 and 34 years of age. This is important, please. Your first sacral segment, we call it lumbarization. It took on the characteristic. It wanted to hang out with the lumbars. It didn't want to hang out with the sacrum guys. So it became more like a lumbar. And that person has more flexibility, but also has a little more instability. So that person with 6 needs more back strengthening. The person, I have people who have 4. And that person who has 4, really that 5 became part of the tailbone. That person has a big tailbone. And that person needs more flexibility. So your case, it's right here. You can see it. I want you to be able to see what I'm showing you now. Okay, so if I do this, you can see, look, T12, last thoracic, L1, L2, L3, L4, L5. And this, you see this piece? That's supposed to be the sacrum, but that
Got it.
That came like a lumbar.
Got it.
You follow me? Okay. So this stuff has been going on anyway, and whatever happened 4 or 5 weeks ago triggered all this stuff.
Got it.
Follow me? Okay. Now, so the idea in your case is we need to stabilize your foundation. That's the key. And now let's go back here and look at it a little closer, and then I'll go into more details. So if we look at the misalignment, we have a slightly short leg on the left. It's only 3 millimeter MD. That's good news. It's under 7. Adjustments will hold. We don't need intervention of anything there. However, we have a rotated sacrum that's dropped down 3 millimeters. So this is a tailbone case. That's what I have to work on. Whether you're telling me right side or left side, the tailbone is what's unstable. Now, according to the numbers, follow me. 3 MD is the measured difference. That's good right now. However, if I work on your pelvis, you have an ASI and PIX. So what it's showing us is this, Kristina. Your right pelvis is misaligned down. Your left pelvis is misaligned up. But because of the tilt on the left, if I adjust this down, it makes it worse. If I adjust this up, it makes it worse. So the answer is not your pelvis right now. The answer is your tailbone. You had a couple of tailbone injuries. It formed that way. You had a couple of pelvic issues later. I don't want to deal with the pelvis right now. That's not your case right now, okay? Unless something really, really comes at me and tells me that I have to do it. You follow me?
Yeah.
Okay. From the short leg or that, you can see you're developing this curvature slightly to that left side. It then comes back to neutral, and this is all compensation for your foundation. You follow me?
Yeah.
Second thing we need to talk about is your digestion.
It's very bad. That's why I want
We're
to.
going to work on that too. And it's a simple solution for you, okay? Why did I say digestion? I'm looking at a few things. Number one, I'm looking at this little hole right here. It's called a Meganblasi. It should be a half black circle. The shape is good, but look, it should be this big. So it's very small. So it tells me you don't have enough HCl. And then I see, if I look close, you have a lot of undigested food in the colon. I'm sure you eat clean, right? You eat clean and organic and non-GMO and all that, but you're not getting the value from the food. We're going to change that today. You want good news now? I have good news. Okay, I do have. I have some good
back
news.
to the good news. Yeah.
Okay, I don't start with good news. You guys don't. You're coming here for good news. Okay. All right. So we're looking at the disc. We said that's the sacrum, or the L6, L5. Your discs are good still, okay? That's your blessing. The discs are good. Okay, maybe this one, this is not considered, I'm not considering this one. It's actually good, but I'm not considering that because that should be the sacrum. These discs are fine. These discs are fine. Even you have a reversal. Now, you crack your neck a lot, don't you? Yeah, you got to stop today. And I'll tell you why. You have ligament damage here. And so you see the neck here, it should go like this, and it should continue to curve back. The reason it doesn't do that is because you have that sway back. So if it's sway back and looking up, you're off balance.
Yeah.
I'm going to get you right. So 2, 3, 4. C4, C5 is where the ligament disconnect is. It doesn't matter. We're not touching that anyway. C7 is where we need to be, right down here. 2, 3, 4, 5, 6. C7. Tailbone, and we need to look at something in the mid-back for your digestion, something in here, okay? But as I change this, you can see a lot of this just curves digestion. You working or home?
Working.
You're working, sitting, standing?
Sitting.
Desk, computer, all that?
Yes, computer.
Okay. I'm going to give you some homework changes, some little habit changes, okay? To make your life a lot easier. Okay, you ready? Okay. Good job. Starting at the base. And the first thing we're getting is C7, 6 points. C1, 5 points. 10 points, but it didn't stop. Look at that. That's interesting. So, you know, they ask, what are we looking for on the meter? We're looking for the break, for it to come back to 0. It didn't stop. It keeps going. Keeps going. Stops there. T12L1. S4, S5. Down low. S4, S5. T12L1, C7, C1. Those are the 4 readings that I'm getting first, okay, ma'am? And let's go ahead and statically palpate and figure out what we got. Huh. You didn't know what you were going to get yourself into when you came, did you? Head down, please. Static palpation, running my fingers down the spine. And we're looking for the edema swell. You can see the edema starts there. It goes all the way. It pulls more. Look, it orange peels right to there. Tender. More here or here? Is that pain when I push here or here?
I think down.
Okay. Let's feel. Back slowly. Back. Extend back, all the way back, lean back. That's 5, 4, 3, come back, back, lean back. 3 or 2?
2.
1 or 2?
2.
Okay, now let's go down into the basement. 1, 2,
2.
3,
3.
4, 5, and yes?
Yeah.
Tailbone.
Starting from 2.
So if I start from the bottom, though, this one, yes? This one more?
Yeah.
That's 5. L2, S5. Sit back for me, please. Scoot back. All the way back. And let's check the neck. 7, 6, 5. Ah. Yes?
Oh, yeah.
Yes. C1, C7, L2, S5. So here's the plan. Okay. We're going to start on the tailbone, S5, over here on the side. Then we're going to go here and do more of S5. Then we're going to do the L2. Then I'm going to have you walk. Then I'll continue on. The neck I'll do last. Okay? Then I'm going to tune up your feet, shoulders, and everything else. You ready? While you're looking
painful?
Huh?
Is it painful?
It may be a little spicy. You eat spice in your food, right? Little spicy. It's like a night. You remember the first time you had arak?
Arak?
You remember arak? You remember the first time you had arak? You know, it had a little bite to it, right? It'll be a little spicy. Okay, not too bad. Right side down. Jokes aside. Let's go right side down, please. Lay on your side. Oh, Zabillah. I'm going to be on the outside for her. Do-do, do-do, do-do-do. Look, it already wants to go, man. Clunk. Gotcha. Come on up. Stand up. Stand up and let's walk. Walk once. One more time. Regular walking. Regular walking. Come over here. Let's go face down. I'm going to do a little more of the tailbone. I'll use the drop board. The sound is the board, not your back, okay? Good. Not that easy. Here we go, here we go. And we said the left is slower, so we need to bring it up. That's the home run. Bus. Tell us. 5, 4, 3, 2. Let's see if we can start L2 here. Perfect. You did good, Kristina. Walk it out. Check it out.
Again?
Yeah, walk. Tell me what's different as you're walking.
More lighter.
I'm asking you. Keep walking. Keep walking. Keep walking. Keep walking. Should be getting easier now, yeah?
Yeah.
Yeah. So whatever we went through is the worst of it now, okay? Now the rest is easy. Let's have a seat and let's work on the neck. Center on the chair for me, please. Sit back. C7, we're going to set as a PLI. So she has a posterior left, but she has a right wedge. So we're going to be on the right side, right there. We're going to bring her into us. Now, because of that rotation, we want to turn the head a little bit away to get the spinous more in midline. And we want to be right there. Relax the shoulder down. Gotcha. Hi. Smile, it works better. Left ear down. Left. That's the home run. Walk it off. Walk it out. Appa.
Better.
Keep walking. I have a really cool video coming out, I think, in a week from Dubai, and it's all energy.
Yeah.
And I did kinesiology with patients' jewelry. The jewelry was making her sick.
Really?
It's a really cool video coming up. Have a seat. Let's retest. Now, that should be a whole lot easier sitting. You see that, right? Mm-hmm. Starting at the base. Neck is clear. L2 is clear. Tailbone is clear. Now, let's recheck it. Scoot to the right a little bit. There you go. You remember what it felt like? Come back. Come on. Come on. All the way back. Good. This is that S1 or the L6. This is 2. Different?
Almost no pain.
3. Pretty cool.
Wow.
Shukran. Good. May I continue?
Sure.
Right shoulder, I'm going to reach over, down. Left shoulder, I'm going to reach over. Let me do the work. On your back, please. I'm going to tune up your feet now, okay? Your homework. 10,000 steps a day, lots of walking, please. Okay? Yoga ball and disc. Yoga ball, sitting on it, bouncing. Sakina will give you all the instructions. Bouncing 5-10 minutes in the morning, 5-10 minutes at night. Easy stuff. Okay? And you'll tell us all the fun stuff next visit. Does it hurt?
No.
They all think it's like super brutal, right? Does it hurt?
Not
Nothing, dude. يلا امشي. يلا امشي امشي امشي. You understand? Walk. Walk.
Yalla emshi.
يلا امشي 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 امشي. You don't speak Arabic, I know.
I will. Yalla
You
emshi.
speak, you speak Russian?
Yes.
Ah. Спасибо.
Пожалуйста.
Good. На здоровье. Have a seat. Назад.
Хорошо.
Вперед. Okay. They're going to be like, how does Dr. Rahim know Russian?
Because you have a lot of customers different Russian that's why. And the answer?
Well, it's more than that.
Yeah.
I actually have some videos. If you look at my from 2019, I have a video when I was teaching in Moscow.
Really?
Yeah. Neck is clear. Kolas. Oh. All good, girl. Last time, all the way back, all the way back, all the way back. Come on, come on, come on, come on, come on. Good?
No pain.
All good. Now buff and polish. Vibration therapy. Then you go home and do your wash and wax, okay? Right now it's buff and polish. This is vibration therapy. When you feel certain areas, it's a little spicy, okay? That's scar tissue. Questions for me? You understand what I found?
Yes.
Okay. We have a few visits.
Okay.
I'm here till next Wednesday, and then I'm off back to Dubai I go to Dubai every month for 10 days. So I'm going to see you a few times before I go. Okay? Good. She's strong. Yeah, you're strong, dude. Yeah. Relax the hand. Squeeze.
Also open our chakras. Can you do that too, doctor? I feel so squeezed.
Squeeze. You should already feel more clear today. So your homework is just go walk, okay?
Just walk.
Lots of walking, icing, and then no weights. Okay. No weights. Squeeze. Good. Squeeze. Welcome to the office.
Nice to meet you.
Nice to meet you too. Okay.
Thank you.
You're welcome.